You're listening to the Public Health Epidemiology Careers Podcast, episode 149.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. Now, I've noticed that many companies have been making public statements regarding systemic racism and bold promises of change. And I've also noticed several public health organizations making similar statements, saying that racism is a public health crisis. Now, this is one that has really captured my attention, and I'm going to explain why, and then I'm going to explain what I'd like to do about it. Now, in the last episode, I asked all of you to press pause and on just everything that was going on around you for a while, and I wanted you to focus on yourselves. As a group of public health professionals, we're all wearing many hats, and we're carrying around high levels of stress. And I urged you to do a self-assessment and take measures to prevent stress from causing harm in your lives and to do your best to take better care of yourselves. And so that we can, be able to continue our mission of public health. You really have to take care of yourself so that we can collectively move forward and advance the mission of public health. Now, in that episode, I was transparent and vulnerable, and I did that because I wanted to demonstrate a point. I just really showed you how easily we can normalize chaos in our lives, and that's just a way of packing on stress. And I was hoping that by sharing my own personal kind of stories, that it would help you, kind of just take a real deep look at where you are and how you're managing your stress and your stress levels. So I'd like to continue in this episode in terms of next steps. Now, I'm not saying that, okay, we're all fully rested and ready to go. I wish that it was as easy as that. It'd be great. But really what I'm saying is that I just natural next steps, like let's take some action and do something about the situation, some of the things that have us, in this sort of stress point. And I think that by coming together, there's a lot of power and collaboration, and we can definitely be more visible and have a bigger impact. That's my view on this. But I'm going to need your attention and your help. So bear with me as I kind of go through this on this episode. I'll try to explain it really well. It's not that it's complicated, but I just don't want to talk too fast over it. But regarding the topic of racism and injustice, I've noticed, like I mentioned early on, several important themes, I guess. And one in particular has really caught my attention. And I'd like for us to take some action on this. So there are so many companies that you've all seen them making these big statements, either on social media or on TV or just all around. You see they're making big public statements, taking a stance against systemic racism, making bold promises of change. And I'm not here to judge whether or not those statements are sincere or not. In fact, I'm hopeful because they've made these bold statements in a very public way. It really gives me some hope that at least they have a high level of accountability. And I just choose to believe that this is a good indication. So, but I've also noticed several public health organizations making similar types of statements. And I'm sure you've all seen the messages across social media, saying that racism is a public health crisis. And that just keeps ringing with me. And this has really captured my attention. I'm going to try to explain why, and then I'm going to go into kind of what I want to do about it. I think it's really captured my attention because I know without a doubt that some of these public health organizations are also a big part of the problem. I know of too many people who are right now suffering in silence because they are victims of racism in their public health workplace. And they're too afraid or traumatized or stressed out to do anything other than keep their heads down and continue to work in their toxic environments. Some of the very systems that post-racism is a public health crisis are also perpetuating the racist environment at the very same time. The people who feel trapped in these systems, they feel like they don't have a voice. Trust me, this is real. You might be listening and thinking, no, that could never happen in my government organization. Or you could be listening and you might be sitting there listening to me with tears filling up in your eyes or rolling down your face because you're thinking, she's talking about me. How did she know? Trust me, I know. This is real. And if you're interested in joining me, then we're going to do something about it. Now, the way I see it is like this. As public health professionals, we need to address this issue at home in our own agencies and organizations, just as much as we need to address them in the public. So it doesn't necessarily mean that everybody gets put on hold until we fix ourselves, but it absolutely means that we cannot run full force into fixing the world with some of our own public health colleagues feeling chained to the system. So how are we going to address this? Well, like I've mentioned multiple times, I do believe that there is power in collaborating. So one of my greatest experiences as a consultant is exactly that. Collaborating with like-minded professionals, coming together, having a bigger voice, a bigger platform, being seen, heard. It just amplifies what we can do individually or as small organizations. When we come together, there's a much stronger power. Now, we have people and organizations that are on just varying levels of awareness. So we have those organizations and people that just have no idea that there's a problem of racism at all in their organization. They're just completely oblivious and blind to it. That's one. Another one is they know there's a problem. They absolutely know there's a problem, and it's really uncomfortable, and it's really an ugly problem, but they don't know what to do about it. They're completely overwhelmed and paralyzed and don't know what to do about the problem. So in turn, they do nothing. They know there's a problem. They have no idea what to do, so they do nothing at all. That's the second scenario. Another scenario is we've got organizations that are addressing the problem with sincere effort. They're stumbling their way through it with all sorts of awkwardness, but they are bound and determined to see success. That's a real work in progress. That's another scenario. And then finally, we do have those organizations that are really and truly smoothly moving forward. They have systems in place to make sure that problems, race or problems of racism are really addressed early on. And they really have very minimal, if any, issues. I mean, they've been at the game a long time ago, way before this last few months of this mass awakening. These organizations have been doing it well and doing it right for years. And those companies and those organizations, they exist. All right. So we need people who can help address each of these scenarios effectively, because even the ones that are doing it well with minimal issues, that's because they've got great systems in place. Their people are working efficiently, but they have systems in place. So we need everyone. We need people who can go into these existing systems that are working really well and just kind of have the checks and balances and make sure that, see if there's any opportunity for improvement there. Maybe even mirror some of the things that they're doing, it can serve as a model for everybody else, right? And then those other scenarios that I've mentioned, we need special expertise on each level. It takes a different skill set for each level to address those different scenarios. The ones that have no idea there's a problem at all, and the problem could be huge, but they're just clueless. We need a special set of people who can address that kind of an issue and that kind of environment. So I really want to highlight consultants and organizations that are equipped and ready and passionate about addressing the need on each of these levels. So here is what I'm really asking. And this is where I'm going to need your help. If you are a consultant or you handle this type of role within your organization, addressing racism, then I want to hear from you. I want to invite you on the podcast to discuss what's working so that others can model after your organization. If you're a consultant, then I want to bring you on the podcast to discuss how you can help organizations because they might be looking for your help. Perhaps you're a consultant and your target is that very beginner stage where they know there's a problem, but they just don't know what to do and they want you to come in. Maybe that's where you have expert skill set and that's where you target. And maybe you're that one who is really, really talented and you're ready to go after the organizations that have a problem but are clueless. Like the leadership do not see it at all, but everybody else sees it. It takes a special skill set. Maybe that's where you are, that's where you are. That's what you do. Maybe that's your superpower, right? So I need all of you. All of you, either that's your role where you work, and this is what you deal with every day with your employees, your coworkers. Maybe that's your task. Maybe that's how you're designed to recruit people to come into your organization. Or maybe that's what you do as a consultant. I want to use this platform in two ways. I want to help improve the working environments within public health organizations and beyond. And I want to highlight and share resources broadly, addressing the needs on all levels that I've described, just a few moments ago. And I keep talking about public health organizations because the public health organizations could absolutely fit those categories. They could know there's a problem, but not really know what to do about it. It really can happen, because sometimes we can address the public, out there. We can talk about what's wrong with other people and other organizations, but we have a hard time internalizing it and addressing and applying our own skill set internally. So sometimes that needs to come from someone else. I know you guys are listening. I know you are. And some of your ears are perked up because you know that's your organization and maybe you're a leader in that organization and you're trying to figure out what to do. And that's what I want to use this platform for, to help provide highlight those resources. So no task is too small. I do not want you to underestimate your superpower with this topic. And I call it a superpower for lack of a better phrase, but it really fits well because it takes a special skill set to address this topic. So I'm thinking of it as a superpower. So if you are very patient and understanding and you do well with navigating conversations on the very beginning, first levels, then I want to hear from you because people need your skill set. Perhaps you're really good at asking questions, conducting assessments, or somehow helping organizations figure out whether a problem even exists. If so, then I need to hear from you. If you are super knowledgeable and maybe somewhat aggressive and ready to take on a fight at any given moment without hesitation, then I want to hear from you because there are people who need your skill set and temperament on their level of this battle. Bottom line is we need all hands on deck. So if you're actively addressing the problem of racism as a consultant on any level, I need to hear from you. If you know someone who is passionate about this and who is actively working within their own organization or who is helping other organizations address the problem of racism, then please reach out to them and ask them to get in touch with me. I really want to bring all these resources together and make these resources easily available by highlighting them on the podcast. I've created an intake form. This is how, we're going to come together here. I've created an intake form and I want to use this to initially assess who's interested in being on the podcast to share their resources, either their business, if they're a consultant, their business resources, or share what they're doing if this is their role within an organization. During this week, so from the time that this podcast is published, which is should be Tuesday, June 23rd, should be the date it publishes if we don't have any technical issues. If you're listening in that week, anytime that week. If you visit my website, you'll see, go to the homepage of my website and go to the very bottom of that homepage. You'll see racism is a public health crisis. And then there's a button that says professionals addressing racism. If you click that button, it'll take you to the form. I'll need you to just fill out the information on that form. And then we will follow up with you after we receive that information. If you're listening to this after that initial week that the podcast publishes and you go to the website and it's not there, just go to the contact tab and send me a message letting me know that you're interested and give me some information about yourself. And then we will follow up with you from there. So my website is drchuntley.com and it's drchhuntley.com. And then right there on that main page, if you scroll to the bottom, you'll find racism is a public health crisis, and then that button, professionals addressing racism. Ooh, that feels like so much I've just put out there to you guys, but please do not hesitate on this. There is a sense of urgency because I really want to I'm ready to take action. I want to move very quickly on this because, I guess as you understand, or some of you may know, scheduling and preparing with the podcast, I usually have things scheduled out several months in advance. I'm completely changing everything around because I want this to fit as soon as we can put it together. So I have no idea what it looks like because I don't know what type of response I'm going to receive. I may receive 1 or 2 responses, which I really hope there's a whole lot more than that. But whatever I receive, I will start to try to rearrange my schedule. If that means we need to add in some bonus episodes, that's what we'll do. I'm really committed to this because I think this is one way that we as a community can come together and provide a solution. It's not the solution, but it is definitely going to be a very good solution to the problem. And I'm always surprised to find when I meet a new consultant and the way they serve in public health. And I meet a new colleague and I found out the type of work they're doing in public health. So I know there are many public health professionals, consultants, or working as employees in whatever leadership role, whatever role there is. I know there are a lot of you that are targeting this and doing it very well. And I would like to be able to highlight your business and your services. If this is what you do as a consultant, then I need to know so we can highlight you and others can find you. Because like I said, so many organizations know there's a problem and are looking for solutions, but it's harder to find if we're all kind of spread out. If we come together, collaborate together, come together, and I lift you up on a bigger platform, then it's easier for them to find you as a solution, as a resource. And that's what I'm really trying to do here. So I need everyone to help me with this and to move as quickly as possible. Go to the website, submit that form if this describes you, or reach out to your friends, talk to them about this, let them know what I'm trying to do, and ask them to please come over to my website and submit their information so that we absolutely work together as a community and make this happen. So I'm really hopeful, excited, enthusiastic, positive, all those good things, because I feel like this is something that we can do. And I'm just really looking forward to putting it together. Okay, everyone, thank you so much for patiently going through this whole description with me. If I went through this too quickly, then just kind of go back to the beginning and listen again if you need to. You can visit the show notes page of the website, have all the kind of highlight points of what I've just discussed here as well. Share this with your community, and I look forward to working with you and us coming together to make this really happen, and share these important resources. Okay, everyone, until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.